Great case of postpartum female dropping hemoglobin, elevated LFTs. What's your differential and what are you going to do? We're going to start with a bleeding CT scan. We're going to do a non-con first, followed by intravenous contrast. This is the non-con, get a ton of information. Hopefully you remember Hounsfield units from one of our first presentations. But on the non-con, blood will be 50 Hounsfield units. It's around the liver. This is very high. This may be the source of the bleed. We're going to give contrast. We're in the arterial phase, and know that this blush of contrast going into the perihepatic ascites. This may be active bleeding, very suspicious for that. And we will continue down into the pelvis. This is a normal look for a postpartum uterus, a couple days after giving birth, enlarged and very vascular. There is going to be some blood around here, but not as high density as around the liver, making us think that the liver is around the liver is the source of the bleeding. This is the HELLP syndrome: hemolysis, elevated LFTs, low platelets. Complications are hematoma, hepatic infarction, hepatic rupture. Hopefully this is picked up before it gets to this point. This is one of the worst cases I've ever seen. And basically a case of spontaneous hemoperitoneum. And be thinking of a couple things: coagulopathy or abnormal viscous, especially mononucleosis. Big spleen, a little bit of injury causes a splenic rupture. Signs radiographically, look for that active extrav like we saw in our case. Look for the sentinel clot sign, that high attenuation hematoma closest to the site of bleeding, in our case around the liver. And the lower attenuation unclotted blood will be farther from the source, and again in our case around the pelvis.